we use the antibiotic and how can we avoid this antimicrobial resistance. So we are on this program. At the same time, as said, sir, diabetes is a very common. We are also going to launch another program, diabetic foot, with the name of diabetic foot, because in this program, which is we are doing with the Federal Health Services Academy, this program we will make a diabetic counter in each of the Tehsil headquarter hospital, even in rural health center or even in district headquarter hospital, where we will deal these diabetic patients separately. Most common complication of this diabetes in at least Pakistan is the diabetic foot. People do not know how to deal with this diabetic foot, so we will give their awareness. We will provide them the soul foot, diabetic soul food. We will provide them, we will give awareness, we will have also seminar. So basic concept is that to create the awareness, because you cannot provide medicine to every person. It is better that you should prevent rather to treat the patient. This is my concept. And because of this, we are doing this we are doing project on both AMR and diabetic foot. Thank you. I'm basically a pathologist, and I am the one who started first time in Pakistan anti-hepatitis B, anti-hepatitis C antibody and anti-hepatitis B in 1998. Because at that time I made an organization with the name of Pakistan Green Task Force. The main object of that organization was to make the country green and to make the country clean. At that time, we started with this slogan that hepatitis C and B is going to become the AIDS of Pakistan, because at that time, AIDS was very important disease as far as your side is concerned. But we believe, because at that time when we make some research, hepatitis B, vaccination is available. We can prevent in that way. So I was the man who started first time the PCR of hepatitis C and B in my private lab from Germany, from Switzerland, and I am also the representative of the gene expert companies like Cellmark and Celldyne, because the people who are going from Rawalpindi, Islamabad or other areas to England for nationality, they need some genetic testing, and I am their representative. I collect their sample and then send to UK. So when there was dengue, I also made first time PCR based genotype of dengue, because at that time this kit was not available for 7 8 years back. I have also honored that I made that research which type of dengue, because there are at that time 4 types in Rawalpindi, Islamabad. I also made. I also made many researches about the hepatitis B and C, and even I have a lot of research on water, because I believe that water and environment, these were two things which which this was my thought in 1998 and 2000, that these are the two problems which are going to be a big problem in the world. And there is shortage of water, and at the same time the weather is changing, climate is temperature is going up, and everything is disturbed with this whole. So at that time I started plantation with this belief that if we will grow more plants, it will have a good effect on the weather. And I was the man who, in Rawalpindi, Islamabad, because mostly I did my philanthropy work in Rawalpindi, Islamabad, zero point 0.7 million trees, which I told you yesterday, and with the success rate of 99.9%. And at that time, people were saying, "You are a madman. What you are doing?" I was telling them, a time will come when the war will be on the water and an environment. And you know what is going on. Again, it is really, I have not so much experience as Dr. Javed Akram, but as far as philanthropy is concerned, that is my passion, and that is and because of that philanthropy, I became the Minister of Health Punjab. And not only I am doing primary and secondary, we have at least 26 district headquarter hospital. We have 125 Tehsil headquarter hospitals. Similarly, we have more than 2,500 basic health unit, and approximately 315 rural health centers. And most of our population is concerned with us because 60 to 70 people are living in the rural area and we are dealing with them. I have also in charge of this TB control program, hepatitis control program, AIDS control program, drug regulatory, and even the COVID. So even the dengue. So I have a lot of portfolio along with them. I am also the Minister of Population Welfare and convener of the Social Security Hospital. So thank you very much for your visit here, and it is really a great honor for us that you are coming, and you will definitely give some experiences. You will share something, and at the same time, Professor Javed Akram is such a learned person. Definitely, he will also share on my behalf. Thank you very much.
Thank you.